traveled to 5 different countries, different places for free as a doctor. In this video today, I'm going to tell you how. What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. So, 5 different places or 5 different countries that I have traveled to for basically free. And I've been getting a lot of emails from people asking, hey, how did you travel to all these places? How do you do that as well as work, still be a resident and travel, have a family, and how do you do it? Well, we're going to talk about that. All right, so the first trip that I went on essentially as pretty much a doctor, I was a last year medical student, 4th year medical student at Georgetown Medical School, and I went to Liberia, West Africa. I went there because one of my classmates from medical school is from Liberia, and our medical school allowed us to travel or take an international elective during our last year of medical school. A lot of schools do this. You just have to check with your school to see what their policies are on traveling, on electives, or some spare time that you have during your 4th year. For those who don't know, that your first 2 years of medical school are spent in the classroom, and then your 3rd and 4th year of medical school are spent in the hospital. Most of your required rotations as well as your responsibilities as a medical student are complete by the time midway between the 4th year of medical school. So you do have some leeway in different electives and different things that interest you as a medical student to complete before you graduate. So luckily, my school at Georgetown gave us that opportunity. They gave us a month block to travel basically anywhere. And essentially there was a stipend that we could apply for, as well as some grants and other scholarships to help fund this trip. So my classmate and I, who is a urologist now, we decided to go to her hometown of Liberia to work in the hospital there, doing emergency medicine as well as general surgery. And even though I was going into orthopedics, just being in the operating room or being around places where you can work up patients that are critically ill, do some suturing, and practice your physical exam skills is really good. So we went to Liberia, West Africa, and once we got into country, we didn't know that there was an Ebola outbreak that was about to start. So to fund this trip, we actually filled out some paperwork. We went to the admissions office and said, hey, we're going on an international rotation. Are there funds available for us to travel? And portion of our stay as well as our lodging was actually supplied by a corporation in Liberia that allowed us to stay at their facilities for pretty much free. So a lot of companies and organizations will provide lodging as well as housing as long as you're in their country and essentially you're helping. So this was a really good rotation for us as well as a really good trip for us because we were able to see certain diseases and certain illnesses that we really don't see here in the US, or not to that extent. There were patients who had really complicated cases of diabetes, tuberculosis, various infections, and the extent of our medical care that we were able to provide was limited by the lack of resources in country. So we were there for about 3 to 4 weeks, and we were able to go to some schools and do some teaching. I gave some talks to some students. We visited a deaf sign language school. So it was really interesting to see things outside of the hospital and see how the people live in Liberia. So the second country that I went to was actually as a 2nd year resident and actually as a 3rd year resident. I went to Port-au-Prince, Haiti twice. One of the surgeons at my residency program has been to Haiti about 50 times in the last 20 years. He's a pediatric orthopedic surgeon as well as a veterinarian. And he's been going to Haiti for all these years to perform surgery as well as to provide his medical expertise. So there was an email that went out one day that said Dr. Such and Such is going to Haiti do any residents want to go along with him? So I immediately responded back to this email and stated that I would love to go to Haiti, and fortunately I was picked to go. So we went to Haiti for about 2 weeks the first time, and the second time that I went, we went for about 10 days. Each of these trips were actually free due to the fact that this surgeon has been over there so many times in the last 20 years. He has been able to obtain some sponsors, and these sponsors cover everything for the entire trip for everyone who goes. So that included lodging, that included food, travel, expenses that came up during the trip. And both times in Haiti were a really good experience as well, just because of the operative conditions. Sometimes the hospital didn't have air conditioning or running water or even oxygen. And one time that we were there, one of the days, we couldn't operate because we didn't have any oxygen in the hospital. In Port-au-Prince, Haiti, they have various residency programs. They have general surgery, they have internal medicine, they even have an orthopedic surgery residency program. And it was good to interact with some of the residents, do some teaching, as well as spend some time outside of the hospital. But this trip may have been a luck of the draw. But my second tip for you is to communicate with people that are around you, the professors, your senior advisors, the people at your medical school or residency program, and let them know that, hey, if there are any mission trips that come about, I would love to be a part of that. And that's how I went to Haiti essentially for free. Haiti is a very beautiful country, and we were able to get out and see some of the parts that are not really shown on TV. The third country that I went to for free was actually Bangkok, Thailand. This was when I was a fourth-year resident, and it came about when I was talking to one of the senior chief residents at another program. And I saw that he had posted online that he had went to Sweden, I believe. And I asked him, I said, hey, how did you go to do surgery over in Sweden? And he told me about a program. It's called the AO Trauma Fellowship. It's essentially a fellowship that allows orthopedic residents to go to various parts of the world to perform surgery for a month. And most orthopedic surgery residency programs, as well as maybe some other specialties, allow their residents elective time. Just as we had elective time in medical school, we were given elective time after you have completed the required number of surgical cases for your training. Well, my program allowed us 1 month to do some elective time in another country. As part of this AO Trauma Fellowship, there were some requirements that I had to do some training prior to this that most orthopedic surgery residents have to do anyway. It's called the AO Trauma Basic as well as the AO Trauma Advanced course. And these are essentially courses that teach us how to fix fractures, how to manage really surgically complex cases. At the completion of these courses, I had to go online and fill out an application, and a couple months later, I was notified that I was accepted to this trauma fellowship program. Being a part of this program allowed me to receive a stipend that covered my travel expenses as well as my lodging in Bangkok. So while in Bangkok, I was there for a month. I was able to participate in some trauma cases, some spine cases, as well as visit some sites that were outside of the hospital. This was actually the first time I was able to go scuba diving, and it was really fun to get outside of the hospital and visit some of the temples and visit some of the other areas of Bangkok, which is a very beautiful country. So my third tip for you guys is to talk to your senior residents, senior medical students, talk to your advisors and let them know or ask them, hey, are there any opportunities that you know about, any stipends or fellowship programs or travel programs that I can potentially go on a medical mission trip? So the fourth country that I went to for free was Amsterdam, Netherlands. And this came about when we were getting ready to start fellowship. There was an email that was sent out that said, hey, who wants to go to Amsterdam with one of our doctors here who's going to present at this conference? And I immediately responded back and said that I would love to go, and luckily I was picked to go. So this conference was called the AOTK Spine Expert Symposium. Essentially, it's a conference where surgeons from all over the world come together to talk about some of the challenging cases or some of the difficult things that we're doing in spine surgery. So this conference is funded by an organization that gives funds to traveling surgeons from all over the world to come together to give their ideas and expertise on certain cases and difficult things in the field of spine surgery. So essentially I had to give a case presentation about something that's challenging in the field of spine surgery. And this organization would essentially take all of our ideas and our presentations and try to come up with different ways to improve the field of spine surgery. So in exchange for my presentation and my input to this conference and organization, well, they reimbursed me for my travel as well as my lodging and food and expenses that I incurred for this trip. So we were there for about 72 hours. We spent some time in small groups, we spent some time in lecture, as well as we were able to go out into the city of Amsterdam and explore a little bit. And the fifth place that I went to for essentially free was actually San Juan, Puerto Rico. As a medical professional or surgeon, internal medicine doctor, cardiologist, every year there are multiple conferences that the healthcare providers get together to meet and discuss the new and innovative things that are in that particular field. Well, in spine surgery, there are lots of different conferences that go on throughout the year. During these conferences, there are medical students, there are residents, as well as fellows and staff that present their research to the other attendees. One of the ways you can have a trip paid for is actually to submit some research that you're doing to these conferences, and if your research is accepted, you're able to fly to these places and attend these conferences and then present your research. A lot of times the medical schools, the residency programs, as well as fellowship programs will actually pay for you to go to these conferences because it's essentially putting their name on the forefront. You're taking the work as well as the research that you're doing at your home institution and you're traveling to showcase that research. So essentially it's free marketing for the medical school, the residency, or the fellowship program, and there are certain funds that are available for the people that are traveling to present at these places. So I presented 2 research articles in San Juan at this conference, and in exchange for that, I was able to receive a stipend to go to this conference. For a lot of residents, fellows, and young surgeons, a lot of these conferences want to get you involved. So the way that they do that, they give stipends as well as scholarships to the younger surgeons, the younger doctors, to get them involved in those conferences. A lot of these opportunities are available online, as well as just talking to your senior advisors or to your senior mentors, or just word of mouth. For this particular conference, I actually applied for a scholarship with one company and I was denied, and I'm not sure why I was denied, but I didn't let that stop me. I was at another conference and I met this lady that she was part of the planning committee for the conference that was coming up in Puerto Rico. And I explained to her, I said, hey, I'm having a hard time finding funds to get to Puerto Rico. Can you help me out? And she said, hey, just email me and we'll try to figure something out. So I emailed her my CV and I told her I have some research that I wanted to present at this conference and I was having trouble finding funds. Well, the committee members of this conference actually came up with a stipend program, a young surgeons stipend program that essentially gave funds to travel to this conference as long as you attend the meetings as well as lectures. So my last tip for you is that if you're having trouble securing funds or finding a way to get to a certain conference, don't let that stop you. Go talk to other people, talk to your mentors, talk to your advisors, talk to the senior people above you and say, hey, I'm trying to get to this conference, but I'm having a little trouble. And most likely the medical school, the residency, or fellowship programs will find some type of way to get you there. So these are the places that I've visited and have went to for essentially free. My tips for you guys are to let it be known that you're interested in medical mission work, this is something that you're passionate about, let it be known to the dean of your medical school, to the academic office. A lot of schools have a international medical office that handles these affairs, so you should seek that out. Let people know that you're interested in research, and that's a way to get to a lot of different countries and a lot of different conferences if you participate in research and you are able to go present your research. So I hope this video helps you guys. I hope you enjoyed it. Let me know in the comments below, what are some other strategies or ways that you have traveled to places for free? I would love to hear from you. This is Dr. Webb. Thank you for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.